Dear students, you must have studied about the formation of brachial plexus and then the various nerves that are coming out from the brachial plexus and their course. You will be having some doubts how to remember the course of these nerves and where they are distributing. Is there any easy way of remembering this course of these nerves and their distribution, especially the area of distribution? So in this small topic, we will be discussing about the work distribution of major nerves of brachial plexus. You are aware that C5, C6, C7, C8 and T1 are the root values for the brachial plexus. So, the union of the roots C5 and C6 unite to form the upper trunk. C7, the middle one, will continue as the middle trunk, and then the lower two roots, that is the C8 and T1, they will unite and form the lower trunk. So, if you keep your 5 fingers and take the thumb and index finger, join them, that will be the upper trunk formed by C5 and C6. Then leave the middle finger, that will be the C7, and it will continue as the middle trunk. Then join the ring finger and little finger, that will be the lower trunk. So this is one way of remembering the formation of the trunks from the roots. Then if you take each trunk, it divides into an anterior division and posterior division. In this picture you can see it, and the posterior divisions of all the three trunks, they unite and form the posterior cord. So that will be a clear remembrance. So all the posterior divisions unite and form the posterior cord of brachial plexus. Then coming to the anterior divisions of the upper and middle trunks, that is carrying the root values of C5, C6, C7, will form the lateral cord. Then the anterior division of the lower trunk formed by 8 and T1 will form the medial cord of brachial plexus. So this is how you can remember them. So the ventral divisions contributing for the lateral cord and the medial cord. Then the dorsal divisions forming the posterior cord. And then there is one general rule before we proceed to the branches of the cords of brachial plexus. The ventral divisions and the cords that are formed from these divisions, the branches that are coming out from these divisions, in general, they supply the ventral or flexor aspect of the limb. This is a thumb rule which you can remember. Whereas the branches coming from the posterior cord of brachial plexus formed by the posterior divisions will supply the dorsal aspect of the limb. This is another point which you have to remember. Then you can go through the branches coming from each of the cords. Here I am not putting stress on the branches coming from the roots and then the trunks. Those things we are not going into the details at present. And then what we are focusing is the major nerves. The major nerves and their pattern of distribution. So what are these major nerves that we have to go through now? So if you take the lateral cord, it will give 3 branches are coming, 3 nerves are coming from the lateral cord. and medial cord 5 are coming, whereas the posterior cord gives rise to 5 branches. So easy to remember the number. So lateral 3, medial 5 and the posterior cord 5 branches. Then how to remember these nerves? For the lateral cord, there is the lateral pectoral nerve, musculocutaneous nerve, and then the lateral root of median nerve. You can remember it as the LML. That is one tip for you. Then what about the medial cord? So it is giving rise to medial pectoral, medial root of median, medial cutaneous nerve of arm, medial cutaneous nerve of forearm, and ulnar nerve. So there are 4 M's are there and 1 U. That's how you can remember it. Then coming to the posterior cord. So there is the upper and lower subscapular nerves are there. So upper is the first one, the lower is the last one for remembering. Then the thoracodorsal, the axillary and radial nerves. So the mnemonic for remembering is the stars for it. And all of you are aware that the ventral divisions, they will be contributing for the cords, that is the lateral cord and medial cord, the branches of which will supply the ventral or flexor aspect of the limb, whereas those derived from the posterior divisions will form the posterior cord and they supply the dorsal aspect of the limb. And among these, you can see the median nerve is contributed by 2 roots, one from the lateral cord and one from the medial cord. Then the other important nerves of brachial plexus are the musculocutaneous nerve, the ulnar nerve, the radial nerve. These 4 major nerves we will consider for remembering their work distribution. Though there are 13 branches of nerves from various cords of the brachial plexus, we are going to discuss about the pattern of work distribution of the 4 major nerves, that is the musculocutaneous nerve, ulnar nerve, median nerve and radial nerve. And for understanding the work distribution of these nerves, the upper limb has to be divided into the arm, forearm and hand. So the work here we have to define. The work is, because we use the word work, it is the motor distribution. So we are focusing on the motor distribution of these nerves in relation with the arm, forearm and hand. So here we are considering which nerve is doing full work, half work and no work in these 3 regions of the limb, that is the arm, forearm and hand. Now let us see the wording for each of these nerves regarding their work distribution, and in the subsequent slides we can explain this distribution. So coming to the musculocutaneous nerve, it's having full work in arm, no work in forearm and in hand. So if you have already read about the course of the musculocutaneous nerve, this sentence will help you in remembering its distribution. Then coming to the ulnar nerve, it is doing full work in the hand, half in forearm and no work in arm. The median nerve is doing full work in the forearm, half in hand and no work in the arm. If you take the radial nerve, it's doing full work in the arm and forearm and no work in the hand. So with this background, we will proceed with elaborating the discussion on the pattern of distribution of these 4 nerves. When you have studied about the course of the musculocutaneous nerve, you have learnt that it enters the arm by piercing the coracobrachialis muscle, and you know the muscles in the flexor compartment of the arm, that is the biceps brachii, coracobrachialis and the brachialis. These are the 3 muscles which you will see on the flexor aspect of the arm, and the musculocutaneous nerve, which is coming from the lateral cord of brachial plexus, that is from the ventral divisions, is supplying this aspect, and it is giving muscular branches in the arm. That means it is doing full work in the arm and no work in forearm and hand, because it is not giving any motor branches in these regions. What you will find is the lateral cutaneous nerve of forearm, which is the continuation of the musculocutaneous nerve, because of which it is called musculocutaneous nerve. So it is motor supply to the muscles of anterior compartment of arm, and it is cutaneous to the lateral half of front of forearm. That's what you can interpret by studying the course of the nerve, and for remembering this will help. Now if you read the course of the ulnar nerve, which is a branch of the medial cord of brachial plexus, so it has to supply the flexor compartment only, or the anterior aspect, because it is coming from the anterior divisions. So this one nerve will be passing through the arm, and then its relations you have to recollect, and its relation with the medial epicondyle of the humerus, then how it will be entering into the forearm, and its course through the medial part of the forearm, and then going into the palm, and its distribution. If you see it, so it is having full work in the hand, that is, it is supplying the intrinsic muscles of hand, the hypothenar muscles, all the interossei, the medial two lumbricals, then the palmaris brevis. It's giving branches. So it is doing full work in the hand, though there are cutaneous branches are there for the medial 1.5 finger on both the palmar and dorsal aspects also it is supplying. Then half in forearm, that means it is supplying the flexor carpi ulnaris and medial half of flexor digitorum profundus. So half work in forearm, and there is no work in the arm. It's not giving any branches in the arm. So to remember the work distribution of ulnar nerve, is doing full work in hand, half in forearm, and no work in arm, and which you can understand by following the course of the nerve and the pattern of distribution. More in the hand, half in the forearm, and nil in the arm. It's about the ulnar nerve. If you follow the distribution of the median nerve, which is formed by 2 roots, the medial root and lateral root, that are contributed by the medial cord and lateral cord of brachial plexus, and this is also formed by the ventral divisions. So it will be supplying the flexor aspect of the upper limb. And if you follow its course running through the front of the arm, and then how it passes between the two heads of the pronator teres in relation with the cubital fossa, then how it passes through the forearm between the flexor digitorum superficialis and profundus, and how it will be reaching the palm of the hand. And if you see its distribution, it is giving branches to the intrinsic muscles of hand, that is the thenar muscles, 3 in number, then the lateral 2 lumbricals. It's also giving cutaneous distribution to the lateral 3.5 fingers on the palmar aspect. So, you know about the distribution of the median nerve in the palm. Then coming to the branches, it is giving in the forearm. They are the pronator teres, the flexor carpi radialis, the palmaris longus, the flexor digitorum superficialis, and lateral half of flexor digitorum profundus, the flexor pollicis longus and pronator quadratus. They are receiving the branches from the median nerve in the forearm. So it is doing full work in the forearm, half work in the hand, and no work in the arm. Now coming to the radial nerve. The radial nerve is derived from the posterior cord of brachial plexus, which is formed by the posterior divisions. So it will be having the root values of C5, 6, 7, 8 and T1 will be there. Then it is supplying the dorsal aspect of the upper limb. And if you follow its course after its formation, how it will enter into the spiral groove, and then how it will come on to the lower part of the front of arm, then how it passes through the supinator as the posterior interosseous nerve, and then its distribution in the forearm and in the hand. What are the branches it will give? If you go through the course of the nerve, you will understand its distribution. So in the arm, it is giving branches to the triceps and anconeus muscles. Then it will give branches to all the extensor muscles in the forearm. So you should have an idea about the course of it and what are all the muscles in the extensor compartment of the forearm. So the muscles that are distributed by the radial nerve. And if you see in this image, you can see what are all the nerves that will be supplied by the radial nerve, and they are the supinator, the extensor digitorum, digiti minimi, extensor carpi ulnaris, extensor pollicis longus, extensor indicis. Then there is the distribution to the abductor pollicis longus, extensor pollicis brevis, the extensor carpi radialis brevis you are seeing. So it's giving almost all the motor branches. Major contribution you are seeing both in the arm and forearm. So it is giving motor branches to the muscles in the extensor or posterior compartment of arm and forearm, and it's giving only cutaneous branches in the hand, so no work in the hand. So only sensory branches to the lateral 3.5 fingers on the dorsal aspect. So the radial nerve is doing full work in the arm and forearm and no work in the hand. Hope now you are in a position to analyze the pattern of work distribution of the 4 major nerves of the brachial plexus in relation with the arm, forearm and hand of the upper limb. So which is the nerve that has got full work in the arm, no work in forearm and in the hand? It is the musculocutaneous nerve. Then which is the nerve that has got full work in the hand, half in the forearm and no work in arm? That is the ulnar nerve. Then what is the nerve that has got full work in forearm, half in hand and no work in the arm? That is the median nerve. Then coming to the nerve which has got full work in the arm and forearm and no work in the hand. That is the radial nerve. Hope you have understood the pattern of work distribution of these 4 major nerves that will help you in attempting to remember the distribution of these major nerves.